Hi, Sarah, and welcome to the Talking Allergies podcast. Thank you for being with me today.
Hi, Grace. Thanks for having me.
To start off, Sarah, could you talk a little bit about your organisation and why you started?
Yeah, so our organisation is ausEE Inc. And I founded that back in 2009 because my daughter, who is now 20, when she was 1.5 years old, she was diagnosed with Eosinophilic esophagitis, or EOE for short. And not knowing anything about that and finding that there was nowhere to turn to in Australia for support information, in a few years after her diagnosis, I realised, this was something we were going to be living with for quite some time. And that's what led me to start the charity ausEE Inc. to support bring people together that had EOS for diseases like I was dealing with for my daughter.
When did your journey with allergies begin?
Well, when Bella was 4 months of age, she actually started what they call fail to thrive. So that's kind of what led us to on the journey with visiting multiple GPs at the time, and then some paediatricians, which then took us to, when she was 18 months of age, a paediatrician she was referred to then suggested that possibly she had something like celiac disease, given by some testing that she had done, which was quite a journey, led us to being referred to a paediatric gastroenterologist at the local children's hospital in Brisbane, and that's when she was diagnosed with EOE. So her first part of being like, I think this is allergies, was actually her EOE diagnosis. And then subsequently she did, over the few years that followed, and actually has anaphylaxis risk allergies as well. She has eczema, she has asthma, she has rhinitis, so she has living with multiple comorbid allergic diseases. But EOE was what came first, yes, for us.
So with EOE started your whole journey?
Yes, it did. And I had not heard about allergies or really understood them at all, so it was quite flawed to be at the time when she was diagnosed. It was quite rare. It was 1 in 10,000 was the estimated prevalence of EOE, and now over the years it has grown where it's as common as 1 in 1,000. So it has expeditedly grown in that time of prevalence.
Were there any changes in your life from being diagnosed with Bella?
Well, yeah, it was just basically everything that it was our first child, so I didn't know any different really, but was not what we were kind of expecting. It did sort of start a big journey of having to just think about everything that she was to eat, constant medical appointments, watching her obviously being fail to thrive, trying to help her in any way we could with that. So it has been quite a journey, and as I said, she's 20 now, so a long journey of lots of things we've tried over the years and to get to the point we are now.
How did you manage day-to-day living with EOE and allergies with her?
A lot of planning, really, just need to be organised. You can't think about going anywhere without thinking about, will she need something to eat? Will she need something to drink? You can't easily find that out there. At the time, something I would say is that has improved over the years is that there is more items available now for people with allergies, that we have seen a shift in that, which is positive, but we still have to always think about it, and especially she has got anaphylaxis risk allergies as well, which is different to her EOE reactions that she has and flares with that.
Could you talk about the difference in anaphylaxis and the flares?
So for anaphylaxis, Bella is allergic to milk, egg, fish and chicken, and she did have more allergies growing up, but she has outgrown some of them, so that's the one she has, and being that she's 20, will likely have for life. With her and so that is an immediate allergic reaction. With her EOE, which causes, if she has to have some medication for that and be mindful of what she eats for that, because that will cause different symptoms. Like for her, it would be people swallowing difficulty, or food can get stuck in the esophagus, or she can have gastrointestinal problems as well. So there's different symptoms she's had over the years. So she's just got to always be thinking about what am I eating, and being mindful of that throughout. Basically, and that's every time. We all eat, and you yourself live with allergies, so you know what that's like. Everything you eat about, you have to think about, And now as an adult, she's taking that on herself. She lives independently, so that is something that she is living day to day.
Thank you for sharing. If you met someone at the beginning of their allergy journey or their EOE journey, what would you tell someone?
I would say you're not alone. Like, reach out to people that are in similar situations, because you don't have to go through this alone. That's exactly like why I started ausEE Inc., because I was feeling so isolated, no information, no other people I knew in our, family, friends groups actually had been living with allergies before, so I just couldn't relate to them and found it really difficult. So when I found people that were going through similar and sharing and hearing stories and just can go through it together. So I would just say, don't be afraid to reach out and ask questions and get support and give support.
Very important to reach out and get support and give support. It's part of our community, and that's a really lovely part of our community. How is EOE linked to allergies, or is there a link?
Yes, so EOE, as I said, is like an eosinophilic gastrointestinal disease. So eosinophil is a white blood cell, and that's involved in hypersensitivity and allergy. So it is common for people that have an eosinophilic disease like EOE to also have other allergic diseases, like, as I said, like immediate food allergies, eczema, asthma, rhinitis. So it is common for people to be atopic and have multiple comorbidities, allergic diseases. And as explained in Bella's case, it was her EOE diagnosis came first, but a lot of times it actually is like EOE might come later after other people have already been diagnosed, so the kid has already been identified as having allergies, but then they also have EOE, they find out.
Thank you. That's a very high link with allergies and those diseases.
Yeah, and I mean, we have support groups with thousands of people in them, so not everyone will also have other allergic diseases, or they would think that they don't think they necessarily do until you sort of say, oh, do you have hay fever? Oh, yes, I do get hay fever. So, yeah, so there's definitely a different broad spectrum of people that have the eosinophilic diseases. So it's not just everybody with allergies, but there is a high proportion definitely that have allergies and other allergic diseases.
Thank you for clarifying. What does Aussie Inc. do to support people?
So our organisation does a lot of different things, from covering lots of areas from support. So we have peer support groups, we have virtual support group chats, and we have Facebook support groups. We provide evidence-based information, so brochures and information about eosinophilic diseases, and resources like children's books that can be helpful for sharing the story to your child about what EOE is, and also to like daycare, childcare, and schools, and even just the health professional community. We like to provide resources to them to have in their waiting rooms and things like that to help raise awareness. We do advocacy work to try to be the voice as part of patient advocacy group for people with eosinophilic diseases, and we raise awareness through awareness campaigns like National Eosinophilic Week, and we also do Feeding Tube Awareness Week as part of our campaign as well, because some people with allergic diseases might end up with a feeding tube, which is the case with EOE, so we do that as well. And we fund research, so medical research into eosinophilic diseases.
That's a lot that you do.
We try to cover a lot. Being a small organisation, everything we can to try to help the community and improve patient outcomes and make a difference. I mean, that is what we're here for.
With someone living with that disease, what does their life look like, or management look like?
Well, there really can be so many variables in it of how it affects, and it can affect people of all ages, and it affects areas from emotional, social, financial, obviously, and just every aspect of their life and the whole family unit. And there is different treatment options. So for some, if they're following like elimination diet, or they have other allergies, so that is different versus if you have medication. So it's also just different treatment options. So I guess what I'm trying to say is that no two stories are the same. There are similarities, but it is really a disease that involves that multidisciplinary team, preferably healthcare team, but also working with them and the families or the individual to find out what the best option is for them and supporting them to get the best outcomes.
Everyone is different and has their own experiences as well. So it's a great point to touch on, that you need to see your own qualified healthcare provider to make sure your management is being looked after correctly.
Yes. And we had worked with organisations like ASCIA, the peak medical body, and there is ASCIA management plan for EOE and an ASCIA action plan for EOE, which are helpful resources to have, work in conjunction with your doctor.
Thank you for mentioning the action plans as well. Before you mentioned feeding tubes, what does feeding tubes have to do with managing?
If someone with EOE has a failure to thrive, or they need, or allergic to cow's milk protein, soy protein, things where they can't get the nutritional needs met through their diet, one of the treatment options is elemental formula. So, and this is the case with Bella. So she started elemental formula when she was 1.5 years of age. But when she was about 7, she just couldn't drink enough formula. So she ended up with a gastrostomy feeding tube that was in her stomach, but she could also have a nasogastric tube. So some people with EOE will might need one of them, whether it be short term or if they can't drink the formula or for whatever reason. As I said, there's other comorbidities at play, then if they have a feeding tube. So our organisation also supports and raises awareness people Australia-wide or even internationally. We include New Zealand in that for people with feeding tubes. And that's for whatever reason the person might have a feeding tube, but EOE is just one of the reasons someone might need a feeding tube.
How long has ausEE Inc. been going for?
Well, this is our 15th year because I started the charity back in 2009. So we've been around for quite a while and we'll continue to do so and trying all we can to help people with EOS diseases. And we're aiming to, and have already started to, branch out to cover other EOS diseases and not just EGIDs like EOE.
Has there been a specific moment or milestone that you've been proud of the work that you've done?
Yeah, well, I've worked internationally with other patient advocacy group leaders in like the UK and America and other European countries, and we worked on a document called the Patient Charter for Improving Care in Eosinophilic Associated Diseases. So I'm really proud of that work and hoping that will lead towards other projects we want to work on, like standards of care guidelines to improve patient outcomes for people. Coming from that, because that was for all eosinophilic associated diseases, we've recently set up support groups and virtual support groups and online for other eosinophilic associated diseases like EGPA and hyper-eosinophilic syndrome, and we hope to be able to support the community further in that regard for other EOS diseases, not just eosinophilic gastrointestinal diseases. That has been our primary focus up until now.
Where can we learn more about what ausEE does, Sarah?
So, yeah, our website is ausee.org. So people can head to that to find about our support groups and our resources and what we do for the community, and reach out through us through, obviously, our social media networks as well. We also have an additional website called 𝘫𝘰𝘶𝑚, and that is our website for our awareness campaign, National Eosinophilic Week, which is coming up in August. And we also have our 𝘫𝘰𝘶𝘭𝘭𝘦𝘺.com.au website, which is where we have our resources and support and information for people with feeding tubes.
Thank you so much, Sarah, for sharing your story with Bella, talking about EOE and diseases, and thank you so much for being with me today.
No worries. Thanks for having me.